So this is Chapter 8, Joints. Now, joints are also known as articulations. It's places where two bones meet and come together. Sometimes there's three bones involved in a joint. I can't think of anything where there's, well, maybe some sutures, there's four bones. But there has to be at least two. Now, it's really about holding bones together. Mobility is one of the functions of joints, but not all joints are mobile. All joints, though, have bones coming together. So really, the function of it depends on how much movement is allowed. So there's three functional classifications. There's three types of joints. There's the freely movable joints, and then there's the immovable joints, and then there's the joints that move a little bit. So the word syn means coming together. The arthra means joint. SES means condition of. So synarthrosis, coming together in a joint, is an immovable joint. So an example of a synarthrosis would probably be joints of the skull, the sutures of the skull. Diarthrosis, dia means through, so they're the freely movable joints. So these are the joints that you think of when you think of joints. These are the joints like your elbow or your shoulder, things like that. The bones move freely in relation to one another. And then there's the joints that are neither freely movable or immovable. And amphi means a little bit. Ambidextrous means that both hands work as the right hand. Amphibian lives part of its life as a fish and part of its life as a reptile. Amphi, a little of both. So amphiarthrosis are slightly movable joints. Now, we don't tend to use these functional classifications all that often. It's more in physiology they do, but generally speaking, in anatomy and for most clinical things, we talk about joints in terms of their structural and how they're put together. And basically, bones can come together in three ways. Again, a list of three. So one of the ways that bones come together is that they're held together by fibers. And so obviously, because they're held together by fibrous connective tissue, then these are called fibrous joints. And they're joints that are prone to being pulled apart. So they resist tension. There are joints that where the two bones come together with cartilage, and cartilage being a shock absorber and more of a solid sort of a connective tissue. Cartilaginous joints are more joints where we're going to get a certain amount of compressive force. And then synovial joints means coming together with eggs. Synovial joints have a gap in the joint. The two bones are not physically together. There's a fluid in between, and that's called synovial fluid. And that fluid happens to be the same consistency as egg white. That's why it's synovial. Now, all these joints are important. We have all of these types of joints in our body. The one that you think of when you think of joints is the synovial joint. But we'll start out with the fibrous joints. So, fibrous joints have no joint cavity. There is some sort of dense fibrous connective tissue that joins the two bones together. they tend to be synarthrotic or maybe amphiarthrotic. There's three types. There are sutures, which are the immovable joints between the bones of the skull. There's syndesmoses, which syndes means ligament, so these are held together by ligaments, and gomphoses. A gomph is a nail or a peg, so a peg in a hole is a gomphosis, and we see these where the roots of your teeth join into the skull. So sutures are the first one. Sutures go bone, bone. Sometimes sutures are called synostoses. Syn, coming together, os, bone. So these are rigid joints. They interlock. There's some very short connective tissue fibers. And as long as there's a little bit of movement in there and a little longer connective tissues, growth can happen, and they're called sutures. When the sutures will eventually ossify, and then they'll be called synostoses. They look like this. It goes bone, connective tissue, bone. Fibrous joints, syndesmoses, are joints connected by ligaments. They can be very movable joints. They can be completely diarthrotic. Most of them are kind of more amphiarthrotic. And it really depends on the length of the ligament that joins the two bones. If the ligament is short, there's not very much movement. If the ligament is longer, there is more movement. So there is the distal fib joint. The at your ankle is an example of a synarthrotic, or maybe amphiarthrotic. It's kind of borderline on that. Syndesmosis. The joint between the radius and the ulna along its length is a big fibrous connective tissue, the interosseous membrane, and that would be considered a syndesmosis. It prevents the radius and ulna from pulling apart, but it's completely diarthrotic. They move freely. So this is an example of a syndesmosis. And you'll note that, so this is the medial malleolus, this is the lateral malleolus, and the talus bone sits right in here. And when you step down, it's going to want to push that out. So this ligament resists that tension. The third type of fibrous joint is the peg and socket joint, the Gomphoses. And in humans, the only place we see it is in the tooth, the periodontal ligaments that hold the tooth in place. Now, the cartilaginous joints are very important, and they're very special. When I was a student, we used to call them primary cartilaginous joints and secondary cartilaginous joints. The primary cartilaginous joints are the Synchondroses. Syn, coming together, chondro with cartilage. Synchondroses, coming together with cartilage. And it's hyaline cartilage. A symphysis goes bone, hyaline cartilage, fibrocartilage, hyaline cartilage, bone. And these are important joints as well. Sim and syn are the same word. So this is, again, a coming together, a symphysis. So in the Synchondroses, there's a plate of hyaline cartilage uniting the bones. None of these move. They are synarthrotic when you see them. An example of a Synchondrosis is where the first rib attaches to the manubrium, of the sternum. So when you elevate the first rib, you also pull up the sternum. It acts as a shock absorber here between the ribs and the sternum, and it's a Synchondroses. We're going to see later that second ribs down are actually synovial joints, but not the first rib. Another example of a Synchondrosis is the epiphyseal plate, the growth plate, in immature bones. And there's a few others. Symphyses, really, because they have this fibrocartilage in them, tend to be a little more resistant. They tend to be able to take more of a pounding. So these are actually more common than the primary cartilaginous joints, the Synchondroses. So there's hyaline cartilage covering the articulating surface, and then there's a pad of fibrocartilage in between. These tend to be amphiarthrotic. Now, the two most common places that they happen are the intervertebral discs between the two vertebrae and the pubic symphysis. You can imagine that the pubic symphysis has to be able to take shearing forces. It has to take compressive forces, like if you jump down and land on both feet, that pushes together. It also has to take tensile forces, legs spread apart or delivering a baby, anything like that will tend to put a tension force on the pubic symphysis, and that has to deal with it all. There's not very much movement happens there. During pregnancy, there's a little bit more movement happens because of some hormones that are released by a pregnant woman that allows a little more motion there. So those are the kind of less common joints. The cartilaginous joints, symphysis and synchondroses. The fibrous joints, syndesmoses, synostoses, suture, and Gomphoses. The vast majority of joints in the body are actually synovial joints, and they are diarthrotic joints. All the joints of your limbs, just about, are these, well, that or syndesmoses. Like I said, most of the joints are this. So what makes a synovial joint a synovial joint? They have a hyaline cartilage, articular cartilage. They have a smooth surface that allows movement. And there's a joint cavity. Now, the joint cavity is really more a potential space. I will demonstrate this concept in class, but really the two surfaces are pushed very, very tightly together, and there's virtually no space in them. It just is that they are not physically connected, so the space is more of potential space. And that space actually has a little bit of fluid in it, synovial fluid. There's also a capsule that encapsulates the joint. It's kind of like a sock that goes around the joint. The capsule is made out of a couple of parts. One part is fibrous, dense, irregular connective tissue that gives it its structure. And there's an inner surface made of synovial membrane. It's a loose connective tissue that has nerve endings and blood vessels in it, but it's where the synovial fluid gets created. The synovial fluid is created in the synovial membrane, and it lubricates the joint. It is a very viscous, slippery stuff that's made. Now, it's constantly being made and constantly being removed, because it also acts to nourish the articular cartilages. Because cartilage is avascular, the cartilage needs to get its nutrients and oxygen from somewhere, and it gets it from the synovial fluid. So the synovial fluid is also responsible for taking away the waste products, the carbon dioxide and any metabolic waste that are produced by the chondrocytes. So it's very important that synovial fluid be present and being exchanged in the joints. And it gets exchanged and it gets stimulated by joint usage. It's a bit of a fallacy that articular cartilage suffers from overuse. More often than not, it suffers from underuse. Osteoarthritis has got more to do with actually improper loading or sedentary behavior than it does by using the joint as it's designed to be used. So in general, it looks like this. There is bone and another bone, a gap between the bone, which is the joint cavity. It's filled with synovial fluid. There's articular cartilage. Right? Anything that's not covered with cartilage is covered with the synovial membrane. That's this green, right? And then that's all held together with this fibrous capsule here. And then it's reinforced against any tension by dense regular connective tissue called a ligament. So this right here is a ligament. Now you can find the ligament in one of three places, either outside the joint capsule or inside the joint, or part of the joint capsule where the fibrous capsule incorporates the ligament. So if the ones that are in the part of the capsule are called capsular ligaments, or more often they're called intrinsic ligaments. We're trying to move away from the idea of intrinsic and start calling them capsular because it makes a little more sense. But intrinsic, part of the capsule, intrinsic to the capsule. Extracapsular ones are ones found outside the capsule. Intracapsular ones are found deep to the capsule. If they're intracapsular, they must be covered with the synovial membrane. So in something like the knee, we're going to see that the lateral collateral ligament on the fibular side is extracapsular. The medial collateral ligament, the one on the tibial side, or the tibial collateral is sometimes called, is an intrinsic ligament. And the cruciate ligaments are found within the joint. So the anterior and posterior cruciate ligaments are intracapsular. Now, these joints move, and because they move, there has to be nerves that monitor where the joint is at any given time. You don't have to look down to know if your knees are bent or if your toes are curled or anything like that. Your brain knows that, and that's because in the capsule there are nerve endings that monitor joint position and any stretch on the capsule. There's also pain receptors there. So it's there to determine if there's articular damage going on, and stopping what you're doing to avoid the pain will hopefully stop any damage to the joint. There's got to be a lot of blood supply because the capillary beds have to make the synovial fluid, and the capillary beds also have to take the waste products away. So synovial fluid is being made and it's being reabsorbed back into the blood, and it happens at these capillary beds that are found at every joint. So those are the distinguishing features: the blood supply the ligaments, the synovial fluid, the joint capsule, the articular cartilage, and the joint cavity. Without those things, it's not a synovial joint. Now, some synovial joints have extra features. They have things that not all synovial joints have. And these are specializations for that specific joint and what that specific joint is going to do. So a lot of them actually have these structures called bursae. Bursae is this, burse and purse are the same thing. It means a bag. A bursary is a bag of money. Bursa, it's a little bag. And it's a little bag that's lined with synovial membrane. And the synovial membranes produce fluid. So it's basically a little bag of fluid. And they're there to reduce friction. A few years ago, that was popular, you buy them in the dollar stores and everything, were these things called silly snakes. They were these kind of rubber tubes filled with fluid that turned in on themselves and were very hard to hold on to, and they were a toy. That's basically what a bursa is, and it reduces friction where muscles or tendons or two bones are going to rub together, and it protects the joint. Now, when that gets inflamed, it's bursitis. And because this is a synovial membrane, there's lots of blood supply, but there's also nerves and pain. So bursitis can be painful because of it. Synovial fluid is produced when the tissue is stimulated. So if the bursa is getting a lot of use, it will fill up with fluid. Sometimes it'll swell. So it protects against friction. Now, something very similar to a bursa is something called a tendon sheath. And a tendon sheath is kind of like a bursa that wraps around a tendon, like a hot dog bun wraps around a hot dog. So it allows for the movement of the tendon through a tight spot with very little friction, and it ends up looking like this. This is a tendon sheath here. Now, it's interesting. People don't tend to get tendinitis, even though a lot of people think they have tendinitis. The tendon itself doesn't get inflamed. What they get is something called tenosynovitis, which is an inflammation of the tendon sheath. It's very painful, and it's inflammation of that sheath. When that happens, there's more friction, and it takes up space, and it's painful, and it's red and swollen, and all the things that inflammation will bring. It's way more common than tendinitis. The tendon itself usually doesn't get inflamed. So when somebody tells you they have tendinitis, they probably have tenosynovitis. And because these tendon sheaths don't exist everywhere, there are very common places to get, quote, tendinitis. And there are places where you just don't get it. And it's because of this.